Dialogue with a Doctor, featuring one of Southwest Florida's leading gastroenterologists, Dr. Raymond Phillips of Gastroenterology Group of Naples.
Welcome to the show. Well, Dr. Phillips, thank you for coming on the show today. I know you're busy and took some time out of your schedule, but let's just tell us a little bit about yourself.
All right, thanks, Jim. Thanks for asking me back once more. I always enjoy speaking about different gastrointestinal issues. As you know, I'm a gastroenterologist, and what a gastroenterologist is an expert in digestive illnesses. Illnesses such as heartburn, indigestion, ulcers, and issues related to screening for colon cancer and other ailments such as colitis, ulcerative colitis, and Crohn's disease. But to be a gastroenterologist, it takes a lot of training. I mean, I went to college at Princeton. Went to medical school at Washington University in St. Louis. And then after completing my time in medical school and graduating from medical school, I did a residency in internal medicine. That was 4 years. I was chief resident the 4th year. And that was at Jefferson Hospital in Philadelphia. And because I'd gone through college on an ROTC scholarship, I went on active duty in the Army at that point and spent 2 years as an internist. And then I was selected for gastroenterology training at Walter Reed for 2 years, and then I was on staff at Walter Reed for additional time for 2 years doing research and staff duties. So the point of recounting all this is just so that you understand that a gastroenterologist is a specialist that is highly trained in this particular area of medicine. And we deal with a whole variety of different issues, as I was saying, digestive ailments, but many of the things that we'll deal with are in the news every day, and we were chatting about one of those items earlier today.
Yeah, and that's probiotics, right?
Yeah,
So
correct.
what is it?
Well, probiotics has really been quite in the news in the last few years, and what a probiotic is, its definition is a bacteria, an organism that when you take it, it can favorably influence the normal bacteria within your colon, collectively called the microbiome. And the basis for probiotics, the prototype, was yogurt, which was developed 5,000-10,000 years ago, which represented a culture of a dairy product where you had fermentation, and that fermentation would lead to an alteration of the particular dairy product. And that would make it favorable to eat, but would partially digest it, but would leave a culture of the organism within the yogurt. And it was found that that culture could favorably influence symptoms that individuals had, such as bloating or constipation or diarrhea. And so over time, the general wisdom had been that, hey, there may be a role for yogurts and then subsequently other organisms that were developed more specifically for purposes such as influencing the microbiome. Over the years, a number of different organisms have been identified as potentially useful for that purpose. The active organism in yogurts is lactobacillus. But there's many other organisms that have been identified that can be beneficial when taken orally. So the principal ones are Bifidobacter is one of the principal ones, as well as lactobacillus. Now, this area has gotten quite a boost recently because of the growing awareness of the organisms in your gastrointestinal system called the microbiome. And the collection of bacteria and viruses and yeast within your GI tract is collectively called a microbiome. It is a happy little community, if you will, inside of you, and it can be influenced by external bacteria, probiotics, and it can sometimes be influenced in such a way that it may favorably influence in symptoms that a person might be experiencing. And so there's been a lot of interest and research now trying to identify probiotics that are effective and at the same time useful for particular symptoms. But the trouble here is that there's a lot of research going on But the interest in it is way out, way ahead of science, way ahead of the research. So, and particularly when you combine issues about potentially beneficial remedies with the potential of making money, you'll see a lot of supplement manufacturers promoting probiotics for various remedies or various conditions. And there's very little research that these manufacturers can provide that demonstrate their particular product is effective for a particular symptom. So although the concept is scientifically valid, it's very difficult for a particular probiotic manufacturer or nutritional supplement manufacturer to really say that, hey, my probiotic or this particular product will favorably influence any symptoms you're having. And so, but that, because of the laws that were passed by Congress, then the manufacturers of dietary supplements or nutritional supplements or probiotics, which is in the category there, Congress passed a law in the 1930s and subsequently validated in the 1990s that they don't have to show any effectiveness at all. They don't even have to show any purity at all. And it's not even clear that they have to show that it doesn't hurt you at all. And so the notion is that none of these manufacturers are terribly motivated to show effectiveness, because what manufacturer would be keen about showing their product is not effective? So they just assume. So that's why you see these very, very vaguely worded sort of recommendations on these different probiotics, encouraging people to take the probiotic for vague conditions that have never been defined. Now, for example, frequently they'll say, hey, take this for a healthy colon. Well, no one's ever defined a healthy colon.
Right.
But if they make a specific claim, take this probiotic to relieve your diarrhea, or take this probiotic to relieve your constipation, or take it to relieve or relieve some other gastrointestinal symptom, then when they're making a particular claim to remedy a particular symptom, then the FDA does say, the Food and Drug Administration says, no, you have to show, if you're going to make a particular health claim, that it's effective. So the health claims that are made by manufacturers are very, very vague. And as a result, a lot of people are not quite clear when they should use a probiotic and for what conditions. Now, we've been talking about what is it. It's an organism, it's a microorganism, typically a bacteria, and usually it's delivered in a capsule, and it's a little bit problematic because it's a live organism. If you take a capsule of a live organism and the organism is no longer live because the product was stored in a hot warehouse in Florida before it got to your store shelf, then it may no longer be viable. Now, there has been increasing attention to that issue with many of the probiotics now being stored in cool locations or refrigerated and paying a little more attention to quality assurance. But other issues are problematic. For example, as you know, when you take a capsule, it arrives in your stomach, and as you remember from your high school chemistry, the stomach produces a lot of acid. The pH is 1. It's very acidic, and it will kill any organism, and it will sterilize bacteria very rapidly by killing them. So these capsules, if they're not designed to be resistant to acid, they'll dissolve quickly in the stomach, and all the microorganisms or the contents of the capsule will be killed off and never have an opportunity to arrive further down in the GI tract in the colon where the preponderance of the microbiome was located. So these kind of issues have been sort of skirted by these manufacturers. They've paid attention to issues like numbers of bacteria, colony forming units, and they typically will promote their product by saying there's 10 billion or 20 billion or 50 billion. The notion is that you need a lot of bacteria, probiotic, to influence the microbiome. And the reason why you need a lot of them, and the microbiome is gigantic in terms of its size. It's 100 trillion cells within the colon, and to think that a billion bacteria in a probiotic capsule is going to influence 100 trillion, it's hard to imagine. So in animal studies, it's been clear that the larger the inoculum, the larger the number of organisms in a probiotic, the more effective it is for a particular symptom. Now, so that's what we discussed for what, and then the question comes up, well, when would you use it? And there are particular conditions where it's useful to consider. And the particular circumstances is that if an individual has undergone gastrointestinal illness, like you've gone on a trip and you have traveler's diarrhea subsequently. I'm not going to pick on a particular country,
That's
okay?
right.
So I'll try to
I wasn't either.
I'll try to be politically correct, but regardless, in your travels you can get troubles in terms of gastrointestinal upset, and in that circumstance, it's reasonable to use a probiotic to help sort of get your microbiome back in order. Similar exposures to other events such as antibiotics. Antibiotics prescribed for a useful reason, say for example a urinary tract infection or a sinus infection or bronchitis, those antibiotics will help those conditions but may harm the microbiome. So it'd be reasonable to use a probiotic for a period of time, 30 or 60 days after an antibiotic course. The other circumstance where it's useful, frequently being in the hospital or subsequent to discharge from the hospital, probably a reasonable thing to do. So those are the principal circumstances where it's worthwhile to consider a probiotic. The difficulty is which one. It's hard to know which one to pick and for which symptom. And so oftentimes, since there is no research that is really valid, and the research is scattered depending on the organism and the amount and the symptom, sometimes we're very much relying on sort of using one probiotic for a couple weeks for a particular symptom, and if that doesn't work, cycling to another probiotic and using that until you see whether the symptom that you're interested in has actually improved in response to using that. If there is improvement, then finally conclude the antibiotic, the probiotic, after a period of a month or two.
My suggestion is set up an appointment and talk to you first, right?
Well, that would be much more effective, and you can get a lot more direct information and direct your efforts, because these probiotics, they're not giving them away.
Exactly.
They're $50, $60, $70 for a month's supply, so you'd like to have a little bit more direction, and certainly you don't want to be using a probiotic on an ongoing basis for an ill-defined reason.
I agree. Thank you very much, Dr.
You bet,
Phillips.
Jim. Thanks again for having me back.
Yep.
Are you in need of a gastroenterologist in the Naples, Marco Island, or Bonita Springs area? Dr. Raymond Phillips of Gastroenterology Group of Naples, along with his fellow physician associates, are board certified in gastroenterology hepatology and one of the most respected medical practices in Southwest Florida. Hear it from one of his patients directly.
I've been a patient of Dr. Phillips for myself personally the last 20-25 years. He's treated my family, my extended family, my friends. I never mind coming here because it's a very friendly place, and everyone here makes me feel that way. They're so caring. And Dr. Phillips, I get a chuckle out of him because everywhere in his building it says, "We work where the sun don't shine."
With the medical industry changing so rapidly, Dr. Raymond Phillips offers the newest technology and treatments in his field. If you are looking for a practice that is attentive and will address all your questions and concerns, call Dr. Phillips' Naples office today for an appointment at 239-649-1186.